Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. In this video, I am going to discuss about the male pelvis and female pelvis and what is the difference between both the pelvis. This is an important topic in the subject anatomy for the first year students. I'm going to discuss about this topic according to the stages of the design thinking. The first stage of design thinking is to define. To define about this topic, the pelvis is a basin-shaped bony structure located at the base of the spine. As you all know, base of the spine is at the sacrum. So it is located near to it as a basin-shaped structure. It connects the axial skeleton to the appendicular skeleton. So the axial skeleton of vertebral column is connected to the appendicular skeleton of the lower limb via this pelvis bone. It is formed by two hip bones. The one hip bone at the left and the one hip bone at the right, both together forms the pelvis. Two hip bones and a sacrum and a coccyx together forms this basin-shaped bony structure. The pelvis forms the pelvic cavity which houses and protects the pelvic organ. You can see in this picture, so this is the pelvis. This pelvis forms the pelvic cavity. Inside the cavity which houses and protects the vital pelvic organs of the human body. It plays an important role in body support, movement and much importantly childbirth. Next stage in design thinking is to empathize. When there is a severe pain during the movement or when there is a difficulty in walking, sitting or standing and reduced mobility and independence, it notices the affected day-to-day life. Then it is called as there is a problem in the pelvis. Common conditions include pelvic fracture, pregnancy-related pelvic pain and hip joint disorder. These common conditions can cause this kind of discomforts in the patient. So we can come to a conclusion that there is a problem in the pelvis. In this picture, you can see the flexors of the hip and the front of the hip. This is when there is a pain here, it is called as groin pain. And the pain can radiate in and out of the pelvis when there is a problem. The next stage in design thinking is to ideate. The pelvic acts as a central support structure of the human body. It transfers body weight from upper body to lower body during standing, walking. Pelvic structures influence posture, gait mechanics, balance and stability. These three are much important in the body mechanics. These three are much influenced by the pelvic structure. Difference between male and female pelvis affect the biomechanics of movement and childbirth process. What are the components of the pelvis? The pelvis, which consists of two hip bones. One of the hip bone is marked its parts, which is called as a big structure, that is the largest part of the hip bone. It's ilium, and the ischium, lower and posterior part. Pubis, anterior and lower part of the pelvis. Sacrum, which is a triangular bone formed together by 5 fused vertebrae. Coccyx, a small terminal bone at the end of the vertebral column. This is the components of the pelvis. Male pelvis characteristics. We need to know what is the difference between male and female pelvis. So we'll discuss about the male pelvis. It is a heavier and thicker bone comparatively to the female bone. And the cavity of the pelvis is narrow and deep pelvic cavity. In this, if you draw an imaginary line, you can see a heart-shaped pelvic cavity. And the pelvic outlet is smaller comparatively to the female pelvis. Subpubic angle is 50 to 60 degree. Sacrum is a longer and more curved. These features makes the male pelvis stronger and more compact. Let's see what are the female pelvis characteristics. Female pelvis is lighter and thinner bone and it is comparatively wider and shallower pelvic cavity is present. Oval and round pelvic inlet is formed when you draw an imaginary line. And the pelvic outlet is larger comparatively to the male, hence it gives a significance in the childbirth. Subpubic angle is about 80 to 90 degree. and the sacrum is shorter and wider. This marked features differentiate the female pelvis from the male pelvis. So I have discussed about the difference between male and female pelvis. It's listed out as a difference between in the flow chart. Male pelvis narrow and deep. Female pelvis wide and shallow. Similarly, male pelvis is heart shaped and there is a long and curved sacrum. Female pelvis is oval and round pelvic inlet is present in the large pelvic outlet. Short and broad sacrum is there. It is a thick, heavy bone, which is a thinner bone, and the subpubic angle is 50 to 60 degree. The subpubic angle is 80 to 90 degree. This comparison is very important in identifying the bone during the first year study of anatomy. Hope you understood about the difference between male and female pelvis. In this picture, you can clearly see there is a wider pelvis in the female, and the comparison with the male pelvis is not as much wider as the female pelvis, which is narrow and wide, which is the pubic arch, otherwise called as subpubic angle. Hope you understood clearly about the difference between male and female pelvis. I'll catch you in some other video. Thank you.